Deputy President, tonight I want to talk about private health insurance. There's been a significant debate in this place in recent weeks about the unwillingness of major private health insurers to pay their bills to the New South Wales Government. It has since come to my attention that private health insurers are currently making submissions to the federal government to be allowed to raise their premiums by over 5%. This is significantly higher than wage growth and higher than current rates of inflation. This is in the context of massive profits. Australian private health insurers earned $2.19 billion net profit in 22-23, which was an increase of 110% on profits from the year before, which was still a whopping $1.04 billion. It is also in the context of providing poor service and inadequate health care coverage to Australians, as Chief Economist of the Australia Institute, Greg Jericho, argued in a column today in the Guardian newspaper. In his words, he said, I quote, "Those who are covered by private health insurance are covered in the sense that a Band-Aid covers a gaping wound." In 2000, about 30% of private health insurance policies had excesses and co-payments. Now it's up to 88%. Even more staggering are the statistics about excluded conditions and modes of care. In 1999, 95% of people who had private health insurance were covered by a policy with no exclusions. That is, only 5% of people had policies with exclusions. Today, it's an extraordinary 65% of those policies that have exclusions in which various items will not be covered. In this context, it should be unsurprising that uptake levels of private health insurance amongst people aged 30 to 39 is also at its lowest levels since the early 2000s. It makes one wonder, why would anyone be buying this product at all when it's clearly not good value for money and it doesn't provide Australians with high quality healthcare coverage at all? The answer lies in Howard-era laws upheld by successive governments which have introduced monetary penalties for those who do not have private health insurance, and some rewards in the form of rebates for people who do. Ostensibly, this was meant to take pressure off the public hospital system. In reality, it's simply the gratuitous use of public money to prop up a failing industry selling a dud product that few people would buy without government intervention. In 24-25, the federal government is estimated to have spent $7.5 billion on rebates to people who've purchased private health insurance. Surely the public healthcare systems operated by each state could make a much better use of these funds, providing direct care to all Australians who need it. This has to be a better strategy than the current process of laundering healthcare spending through the private purse, allowing massive healthcare insurance corporations to take their cut to the tune of billions of dollars and lots of executive bonuses along the way. We know there is a crisis of healthcare in Australia. Waiting times in hospitals are exploding. People can't get the care that they need. There's a gender gap in healthcare as well, as the Royal Australasian College of General Practitioners has explained. Women are more likely than men to have chronic health conditions and more likely to delay treatment due to the cost. According to the Royal Australasian College of General Practitioners President, Dr. Nicole Higgins, women are missing out on medical care because they can't afford it. Women are twice as likely to delay seeing a GP due to the cost than men. The Minns Labor government is doing everything possible to fix the healthcare system in this state, including upgrades to and building new hospitals to increase patient capacity. But we can only do so much, however, while the system as a whole remains broken. The federal government must, for example, increase Medicare rebates so that people can access GPs for routine services without paying exorbitant fees. It seems to me that changing the way private health insurance works would be a step in the right direction. As Ian McCauley, a research fellow at the Centre for Policy Development, concluded after extensive research into the private health insurance system, quote, "Rather than making private health insurance work through subsidies and incentives, we should make Medicare work and give up on private health insurance.